Good afternoon, everyone. Thank you for joining us. I'm Dr. Michelle Walker-Davis, Executive Director of the DC Public Charter School Board, and we are the agency that creates the policies and conditions that empower your teachers and school leaders to do their best work, and that's educating your students. Thank you to all the parents, caretakers, and families that took the time to join us today to hear more about this important topic. As a parent myself, I'm looking forward to hearing firsthand more about the COVID vaccine for our children. And as the holidays approach, I'm sure we all have plans to get together with loved ones, and really having the vaccine available for children certainly helps ease the worry and strain of this time. We are pleased to partner with Children's National Hospital to host this town hall, and we are fortunate to have a local expert, Dr. Claire Boogaard, to present and answer your questions. Dr. Boogaard will begin with a 20-minute presentation followed by Q&A. So be sure to put your questions in the Q&A as they come to you, and we will make sure to monitor that and have Dr. Boogaard be able to answer those questions. By way of background, Dr. Boogaard is a clinical pediatrician at the Children's National Hospital. She serves as the medical director of the COVID-19 vaccine program for the hospital. She's also an assistant professor of pediatrics at George Washington University School of Medicine and Health Sciences, and an affiliate faculty member of the Child Health Advocacy Institute at Children's National Hospital. Dr. Boogaard is passionate about preventative, community-based care with special interest in toxic stress and early childhood development. Welcome, Dr. Boogaard.
Thank you. Thank you so much, Michelle. And thank you all for having me. I wish we could have done this in a different setting where we can all see each other's faces and actually interact, but we're getting there slowly but surely. And hopefully this conversation will help us kind of reach that reality sooner than later. I really want to thank you all for joining us today. It's a Friday. It's been a long day for some. It's been a long week and month and season for others. And I also just want to point out that the recent news, I know that I just heard about this afternoon about the Kyle Rittenhouse acquittal is probably bothering many people. And so this is going to be recorded. So if you want to spend this hour taking care of yourself, please do so. It's an important topic, but there's many important topics today. And so just know that this is here for you and your information. You can also reach out to me if you have any questions afterward. I really do welcome any communication. This is all about trying to empower you guys as parents and community members with the information that you can share to your loved ones to keep us all safe. So I'm just going to start like Dr. Walker-Davis said, like with a really quick presentation to kind of lay the groundwork to make sure we all kind of understand the same things related to COVID-19 and the vaccine. And then I'm hoping that most of this conversation will be a question and answer session. Of course, the chat is there, but if you wanted to, raise your virtual hand or ask a question, in reality, I love these conversations. I have them weekly in clinic with patients, and then of course have been having this conversation with everyone from my own family members to honestly, neighbors, people on the street, whoever I end up talking to about it. But I'm not here to pressure anyone. I just want to be a safe space to answer questions so you feel comfortable with the decision you're making. So to help you with that, I just have a few disclaimers. And the first is that, just to point out, I get absolutely no funding from Pfizer or BioNTech. In fact, my salary doesn't depend on anyone getting this vaccine. This was just I like to think of it as a deployment within my work where they just had me redirect some of my time to focusing on this initiative as opposed to seeing patients. So nothing really changed for me financially. So my interest in this is truly as a doctor and then as a mom. I myself am a working mom of a 6 and a 4-year-old. And so when I took this job back in the spring, I just said, this is something I'd volunteer my time to do at this point. So I'm happy I could have the protected time to work on it. And with that, I just want to acknowledge the many superheroes on this call, the teachers and administrators that pulled off the phenomenal changes that kept our kids engaged and learning over the past year was pretty incredible. To the parents, both who work inside and outside the home, your strength through this pandemic is very apparent in your children. I know I don't see all of your kids in clinic, but the parents who have been able to thrive and be resilient through this have been able to protect their kids in ways that you can't even imagine. So, and if you're one of those who thinks you might not even qualify, as I agree with that, sometimes I'm like, I don't think I thrived during this, or I think I could have done this much better. All the effort you put into it, I promise, was seen by your kids and will reflect in their problem solving skills later in life. And then of course to the kids, I'm a big child advocate being a pediatrician, and this can be emotional to me because the children through this pandemic have been really big superheroes. As we know, they have sacrificed more than many groups of people have, right? Given that they don't have a lot of agency over their own choices. And everything from stopping play dates and birthday parties to virtual school, to stopping sports practice, to staying at home with their stressed out parents. These kids essentially stopped their whole life and adjusted just to keep, for the majority, for at least at the beginning, as we thought about, they were mostly just trying to keep us safe, the older loved ones in their life. And so now I'm really happy to start talking about how we can give them that safety and protection that they deserve and that they've waited a long 21 months to get. All right, so on to the science, I guess, of it. COVID-19 pandemic. This is not something we have to start from scratch on. Everyone is more familiar with pandemics and viruses than they ever have, no matter what their baseline knowledge was a couple years ago. And this is the data as of yesterday that I got right off the New York Times website. But what this shows you is that from February 2020 to now, where this graph ends, I'm not sure if you guys can see my mouse, but where this graph ends over here was about early November, is that we've had different waves and spikes of this pandemic. This was, if you can imagine, this was our reality last Thanksgiving. And this was the highest surge that we had. This was considered our third surge of coronavirus. And then, as you guys remember, we had a nice beginning to the summer where we started to feel things opening up. And then this surge here is mostly related to that Delta variant, which is the mutation that the virus took early last year that then had spread through our community and is far more contagious, but luckily still does, the vaccine still does give us some protection towards. And if you see here, we were coming down from what we were seeing in September. And then this tick up here is a little disappointing to everyone. We were hoping this would continue to go down, but we think this here is the change in weather, getting people back inside, mixed with possibly commuting more now as holidays go forward. So we'll be watching that carefully. If you guys are interested in this data, it's available to everyone on New York Times. And what you can also tell is that usually the test rates, the hospitalization rates, and the death rates mimic this. Just keep in mind that when you see cases going up, even if hospitalizations and deaths are going down, that's usually what we see at the beginning of a rise, because these tend to be about 2 weeks behind these. So just keep that in mind. And then here, when I just brought this up, because this is something I look at when I think about my Thanksgiving plans, is there are a lot of hotspots throughout the country. And really most communities, most large communities for sure, but most communities throughout our country are still very high risk for coronavirus, even now in November 2021. What we are here to talk about today is a way to kind of avoid that and to stop this pandemic. And one of the most important things is the vaccine that we're going to talk about. And I just wanted to show this graph. This shows that the people that are getting infected now are mostly unvaccinated. So those that are getting infected, if you are unvaccinated, you have you're 6 times more likely to get infected if you're unvaccinated, and you're 12 times more likely to die if you're unvaccinated. So that's why this is important. Given that we're here in DC, I just wanted to show you some local data. This graph is a little bit less easy to understand, but shows similar data to what we saw in the last picture. But I think the most important thing is what they stated. Our levels here are still really high. So it's something we need to consider. Even if you yourself feel safer than you did at other points, the level is high and no public health official feels comfortable yet. And then this is some of the data. This information, I should say, I'm getting right off of coronavirus.dc.gov, which is our city's website that gives a lot of really good information, again, open to the public. But this shows that which outbreaks we're having in schools and which type of schools. And then also, I thought was interesting here, the students are getting affected much more than others, and usually elementary school kids. And this is important because these are the kids that have been unvaccinated, right? So the most vulnerable through the school setting. All right. Now, at the beginning of the pandemic, there were a lot of misconceptions about coronavirus in children. It wasn't meant to be false information, but it was really just us learning this pandemic and learning this virus and trying to not use our anecdotal information to share, but to really gather the data so we could speak to it in full and with scientific accuracy without including our bias. And unfortunately, what we've learned is that COVID affects children, right? The virus itself has medical consequences and then certainly emotional and academic and social consequences. And so this is something that always comes up when we talk about the vaccine. I'm happy to go into it more, but what I do want to point out is myself as a mother, when I think about coronavirus in children, I think, one, I don't want my kid to get sick. The acute infection itself, although rarely, can be lethal in children. 1% to 2% of kids that get coronavirus are hospitalized. I should say 30% of the people that are hospitalized, so a third of the ones who are hospitalized, have never had a pre-existing condition. They are perfectly healthy. And then when you look at the kids that are hospitalized, a third of them will require critical care or life-saving treatment. So that's, medicine to keep their heart pumping or a tube down their throat to help them breathe. Now, most kids do fine, right? But then there's also a couple other concerns, and even the kids that just do fine right off the bat, and that's the post-COVID syndrome, I'm sorry, I should say, or long COVID. These are the kids who have symptoms that last longer than 4 weeks, which is really atypical for a typical cold, as many of us know. We're learning more about this. Children's has a big study going on to study these kids for years to get an understanding of what's happening, because there's a variety of presentations of this. It can be everything from fatigue to shortness of breath to neuromuscular complaints. And what we do know is that the prevalence is pretty high. Right now, they're estimating 13 to 35% of kids will have this. And we're just trying to figure out how to better treat it and prevent it so that we can get these kids back to their normal life. Most of you might have also heard about the multi-system inflammatory syndrome in children, which we call misc. Misc is how you might hear it. And this is the one that as a mom, I would never want my kids to get because 2/3 of the kids that get this do require critical care. It's a life-threatening inflammatory syndrome that usually comes 6 to 8 weeks after a kid has a pretty mild course of coronavirus. We aren't sure why this happens. There is a similar syndrome that's not as severe that tends to occur after other viruses. It's called Kawasaki's disease. That we've known about for years, and luckily some of the same treatments work. But at the same point, this is very devastating. It's essentially where one or more systems in your body, so your cardiovascular system, your GI system, get so inflamed that they stop working and shut down. And that's critical to preserving life, is having all your systems work. And so this requires a lot of intervention and is very scary for families. And then finally, from a medical consequence standpoint, even if you don't contract COVID, the pandemic itself has had a lot of impacts on kids' health. There's been a significant rise in obesity, and type 2 diabetes has tripled over the last year. That also leads to the mental and emotional consequences. Of course, if you're hospitalized and sick, there's a lot of evidence that people that spend time in an ICU can experience post-traumatic stress after being there. But in general, we have seen an incredible rise that was already rising prior to the pandemic of mental health concerns in kids. They're attributing this not only to the social isolation related to the pandemic, but also to the prolonged fight for racial justice that we've been having in this country that has also been highlighted over the last couple of years. And all of that together is leading to more emergency room visits for kids with mental health concerns, and then more attempts at suicide. And then socially and academically, I don't have to tell this group this, as parents and educators, virtual school was a blessing in many ways because we were able to continue some learning, but we know it's not the preferred method for anyone. And then of course, the lack of socialization and activities for children have weighed heavily on kids of all ages, and is something that they're ready to get back to. All right. So my husband said I shouldn't talk about COVID at all, but I felt like we should paint the picture. So my apologies if you're on his side of the discussion. But as you guys know, there are ways we can protect our kids, right? So to help us avoid these consequences, we can wear masks, we can keep them socially distanced, we can avoid crowds, wash our hands, cover our coughs and sneezes, clean and disinfect, monitor symptoms daily. Some of this we should do no matter if there's a pandemic or not. And many of these we are very sick of. So the good news is we now can also get them vaccinated to get us through this pandemic and hopefully end it sooner than later. So to understand how vaccines work, I wanted to walk you through this. This slide could be helpful if you want to read along. If you just listen to what I say, it might be helpful. Vaccines are something that we've had in our country for hundreds of years. We're going to talk specifically about the Pfizer vaccine today because that's the one that our youngest kids, 5 to 11, are able to get. And it's one of the messenger RNA vaccines, which we'll talk about in detail. But the most important thing that I say when we talk about vaccines is that a vaccine is not magic. Your body is doing all the work and has the magic inside of it to protect you. All we're doing is priming your immune system to do what it does normally. So if I'm walking down the street and someone coughs or sneezes on me, I have what we call an antigen enter my body. So something foreign to me enters my body, and then my blood cells are circulating through my bloodstream and are literally just grabbing a hold of things and being like, should you be here? Oh yeah, you belong here. How about you? Nope, you don't belong here. And so if it sees something that's foreign and they know it does not belong to your body, an antibody will grab a hold of it and hold it tight until it can signal to the other white blood cells to eat up the antigen, so the foreign bit, and to build a response so if they ever see it again, your body can protect itself against it. And so when we give a vaccine, whether this is the flu vaccine that we get annually or your child's getting their DTaP vaccine as an infant, what we're doing is we're telling your body, hey, look, here's a little bit of something that doesn't belong to you. We want you to be aware of this and build an army of antibodies to protect you against it in case you see it in real life. And that's what's happening here. Now, there's a lot of concerns about the messenger RNA vaccine because it seems relatively new. But I can tell you from a technology standpoint, this is actually old technology. It's been around for about 8 to 18 years at this point. This was made because the government was smart, 2 decades ago, and realized that with bioterrorism and climate change, that a pandemic was something that we should be prepared for. And so they wanted to invest in a technology that would just make it easier and faster for us to protect more people if this were to ever come about. It wasn't hot news back then when they invested in it, so people didn't really know about it till recently. And I always remind people, think about your cell phone 17 years ago, if you even had one. The technology has improved a lot by then, but again, this is considered very proven, well-studied technology. And the difference with this vaccine, so now I'll talk about the Pfizer vaccine, is that instead of giving you a piece of the virus, which is like measles, mumps, rubella, or chickenpox, is a little bit of the live virus that we give you, or instead of giving it an inactivated virus, which is like the flu shot, or even just like a protein here or there, what we're giving you is a recipe called messenger RNA that will go and enter your cell, which you can see here around 0.1, and your cell's factory is going to read that recipe, eat the recipe up as it's read, and build a protein. If you guys have seen the COVID virus, and you can see it down here on the lower part of the screen, all coronaviruses, which is why they're called coronavirus because of crown, have these spikes sticking out. That's what every virus will wear. The spike protein itself is harmless, doesn't hurt you even on the virus. All it does is helps the virus stick to your cells. So what the messenger RNA creates is the spike protein. So instead of having the virus float around, now you have a bunch of spike proteins floating around your body. Your immune cells grab a hold of it, know that it doesn't make any sense to be there. They will build an immune system response against those spike proteins. They will eat those spike proteins up in like a week or two. And you'll be left with a circulating army ready to attack if it ever sees a spike protein again. That's very good because so far, all the coronaviruses wear the spike protein. So if you were to encounter, after you're vaccinated, if someone coughs or sneezes on you with COVID-19, with SARS-CoV-2 virus, your body already has an army. So when it grabs a hold of it and says, oh, this is weird, that's one of those spike proteins again, it can eat up the virus before the virus can do much damage to you. This is important to remember because this is why we talk about breakthrough infections. Breakthrough infections are certainly possible, right? Nothing in science is 100%. And this vaccine right now is about 90% effective in kids, which we'll talk about. But that does mean that about 10% of kids will get enough, or people, it's everyone 5 and up who's vaccinated, will get, there is a chance that 10% will get exposed to the virus and develop symptoms. But since the army is ready to go and ready to work, they are far less likely to have the severe consequences from it. All right. So this is the exciting thing that we're here to talk about, which is that the Pfizer vaccine is now available for children. I, again, can answer any questions about this, but to kind of orient you to it, this is going to be the orange cap bottle, which you're welcome to ask, your pharmacist or your doctor if they're using. And it is 1/3 of the dose for the older kids. So the older kids get a 30 microgram dose and the younger kids will get a 10 microgram dose. Again, the pediatric dose is in the orange cap. Currently, the 12 and older, which includes the adults, come with a purple cap, but it will be turning gray. There's another gray one coming to the market relatively soon. So just want to prep you for that. And the dosing is based off of age. So you don't have to worry if your child weighs more than another 6-year-old or something like that. It's based off of how well your immune system will work, which is unrelated to how large you are, how much you weigh. This is also relevant for those of you who might have like a child who's turning 12 in January and you're curious, should I wait till January to get the older dose or should I get the dose now? And what if the birthday falls in between? What we say is if you're ready to get the vaccine, get it today. It's the safest thing to protect you and your family. There's no other way to guarantee, especially if coronavirus keeps climbing again in our community, to keep you safe. But if your 11-year-old gets dose 1, they'll get a 10 microgram dose. And then if they come back at 12 years to get dose 2, which is usually 21 days later, they'll get the higher dose. And there's nothing magical that happens on your 12th birthday with your immune system. It's just how it was studied. So they're both safe and effective doses. There's a lot of questions, and I know today they just announced that all adults should be getting a Pfizer or Moderna booster shot, if you haven't heard that. But so far for children, there's no more boosters are not getting talked about for kids under the age of 18 yet. And then for children 12 and older who are immunocompromised, they want them to get a 3rd dose. We know that they build a better response with the 3rd dose. However, for the 5 to 11-year-olds, we don't have that data yet. So that's not yet the recommendation, but I highly anticipate it will be at some point. So just keep your ears to the ground, keep checking in with your doctor, because that might be something available for your child if they're immunocompromised. And then what do we know? What do we know about this new vaccine? Why are we excited about it? Well, we know that it works. So it's over 90% effective at preventing symptomatic COVID, which is great. So in the study, they showed it was, again, close to 91% efficacious. There were only 3 cases of COVID in the group that got the vaccine compared to 16 in the placebo group. And the placebo is just like a dummy vaccine they gave. So in the trial, you either get the real vaccine or the dummy vaccine, but they don't tell you which one you're getting so that it doesn't impose any bias into the results. And then all cases of COVID occurred in children without a history of prior infection. And none of the cases met the criteria for severe infection, which is great. The other thing is they didn't analyze which variant it was that these kids had gotten when they got it, but knowing that they were studied in July and August of 2021, most of these cases will probably be the Delta variant. So this is really good news. And then if you're concerned about your own child's health, again, happy to answer specific questions, but they incorporated 20% of the kids that were studied in the initial study did have some comorbidity. So had another infection like obesity, or sorry, another medical condition like obesity or diabetes that did increase their risk of a COVID-19 infection. The good news is since this became available 15 days ago, it's now been given another 2.3 million times. So even though this study felt really small to many people to begin with, even though it was rigorous and completed all the safety standards that any vaccine in this country has needed, if that helps you, it's now been given 2.3 million times. And we as doctors are required to report on any safety things that come up. And they usually stop it very quickly if there is something concerning. You guys remember the Johnson & Johnson discussion from the spring. And so far, that's all good news. to speak about the safety of it. The study itself, and now what we know as we've started to implement this, is that it's really safe. The only side effects that were presented during the trial are the side effects that we expect when your body is building an immune system response. So the pain, redness, and swelling at the insertion standpoint is just because we're injecting something into your arm. And then throughout the rest of your body, you can be tired, have a headache, muscles pain, maybe chills or fever. And that's, again, in response to that, the hormones in your body and the white blood cells communicating and building that immune system response, which takes a couple days. Good news is this only lasts 1 to 2 days if they occur at all. It's also less than the older cohort. They studied the younger kids and then they looked at the older kids and they said, actually, the younger kids are having less side effects. So I think that's probably due to the reduced dose of vaccine, but that's a really good sign. And then from another safety perspective, as a mom, I loved to see this, that there were no serious side effects reported, no deaths, no allergic reactions, no myocarditis. So we would still be having this discussion if they were part of the study, right? And we would have to weigh risks and benefits in certain kids. But the good news is it looked really safe across the board. And again, we're getting more information by the day. And so keep an eye out. But right now, I can say anecdotally, as someone who spent a lot of time in vaccine clinic over the last 15 days, kids are going back to school the next day or right afterward. My daughter, who tends to be dramatic, did completely fine. She complained about her arm being sore for a day, and the next day was right back at it and didn't mention her arm. And then we've even seen kids, parents bring in one kid one day, one kid the next day, and they're reporting the same thing. Everyone's reporting really mild symptoms, at least after this first dose. So who can get the vaccine? Essentially, any child between the ages of 5 and 11-year-olds can get this pediatric vaccine as long as they've never had an allergic reaction to a component of the vaccine. When you go to get your child's vaccine, they'll give you a list of components, but a lot of the words look like a chemistry test. The only one I would say to really look out for is polyethylene glycol. That's Miralax. So if your child has had an allergic reaction to Miralax, then they are not allowed to get this vaccine. And then please talk to your pediatrician about what the other options are. However, the rest of the components of the vaccine are pretty simple. It's salt water, a little bit of sugar, a little bit of fat, some potassium, and a little bit of messenger RNA. And so your body's made up of most of those things, so it's really unlikely to have a reaction. There's 2 groups of people they say maybe consider waiting 90 days from these things before getting the vaccine. One is if you have a history, if you had gotten the COVID-19 infection and they treated you with monoclonal antibody therapy. So that's actually an IV treatment. So it's something that would have gone through a needle in your arm as opposed to something you took by mouth. Then they say wait about 90 days. That's essentially because they're giving your body some pretty blanket antibodies that will wean with time. And so if those antibodies are there while we give you the vaccine, you won't build a really strong immune system because you already have these things floating around in your system. The other thing is if your child had a history of the multi-system inflammatory syndrome in children, they recommend possibly waiting 90 days, though not mandatory. They want to see that your child has recovered and that their heart function is back to normal. And then otherwise, most people are recommending the vaccine. I would say they were not studied in that initial group. So, speak closely with your doctor if you have any more specific questions than that. But for the most part, everyone that I've seen filtered through our cardiologists and these questions coming, everyone has been recommended to get it. And then we recommend this for children who have gotten the COVID-19 disease as well. What we know is if you get COVID, you have to stay, isolated from everyone to prevent the spread of this pandemic for at least 10 days. This is the same guidelines we followed, since the beginning. Of course, at 10-day mark, we want to see that you've had no fever for 3 days and the symptoms are improving, and then you can come out of isolation. What we know is that each body responds differently to the natural infection. But if we give anyone that had the natural infection the 2-dose series of vaccine, that they're actually the most protected of anyone in the community. So we highly recommend that for kids. The other thing is just this can be given. Don't let anyone tell you that it can't be given with the flu shot or you can't get it because you're due for, your 11-year-old vaccines or some kind of routine vaccination. These can be given alongside it, or there can be no minimum distance needed to be spread between them. So let me know if you're hearing that in the community, because we want to make sure people know that this is totally appropriate. And then where can you get the vaccine? Coronavirus.dc.gov, which is DC Health's website, has a lot of up-to-date information. They're updating every day since the pandemic began, and they're highlighting all the unique ways that they're delivering the vaccine to the community. So please take a look at that. I know many of the schools also have vaccine offered there. The other thing I want to point out is that DC's been an amazing partner through all of this, and they are also mandating that employers give parents paid leave to take their kids to get the vaccine. So please don't let that be an access barrier either. And then I'm working at Children's National. We are now open for business for any child 5 to 11 to vaccinate. So if your own pediatrician isn't offering it, if you couldn't get an appointment at Walgreens, just go on our website. It's just type in Children's National COVID-19 vaccine. It'll take you to this page. You click on that button and it'll walk you through it. The other thing that they have on here is a lot of up-to-date frequently asked questions. So if you need to see this in writing or you want links to certain things, please go there for more information as well. All right, well, I'm sorry to talk so much. I'm going to stop sharing my screen now, but I would love to answer any questions you guys have and see how I can be useful, like pick my brain, see how I can help you.
Thank you so much, Dr. Boogaard. I don't see questions right now, but I can start off with one. It says, will my child need a booster shot?
It's a good question. And I don't have the answer right now. We don't know. And like I said, the adults have just gotten full approval to get their booster. So I recommend anyone who's vaccinated to go do so. And the reason that is because we've seen waning immunity. So the antibodies your body does produce wane a little bit over time. And we think that it'll probably be a 3-dose series going forward. So we recommend that, but we're not sure about kids. And it'll be interesting to see how it plays out, because if the levels stay high in the community, then we might see the waning immunity in children 6 months after, right, we gave the vaccine. I think I'm hopeful that 6 months from now, we're in a different place with the pandemic. We have most people vaccinated. Our rates of disease are lower, so it might be harder to prove that necessity, but I'm not sure at this point.
Okay, we have a couple coming in. Moderna create a vaccine for children in the coming months.
Will Moderna? Yes, they are working on it now and enrolling children, but it is not yet cleared even for children under the age of 18. So we are waiting on that data, and they're working on it, but it is not yet available.
Okay. Do you have a sense of when the vaccine will be approved for 2 to 5-year-olds or 6 months to 2-year-olds?
Oh my God, that's $1 million question in my life right now, both personally and professionally. We were hoping it would be prior to 2022. I think I'm safe to say that's unlikely, because if we even just look at the pace at which we heard about Pfizer submitting the data for the 5 to 11-year-olds, it took about 6 weeks till we actually were able to put a shot in an arm. And if you look at 6 weeks from now, it's essentially the new year. So my hope is still January. I'm not giving up hope for that. I know that they are working hard. I know that they've certainly enrolled the 2 to 4-year-old group, and the last to enroll were the 6 month to the 2-year. Our hospital does contribute to the trial data. We had our own trial, and we've been fully recruited for months. But I know around the country, they are having a hard time recruiting for that small age group, just out of like hesitancy in different places. But as soon as they get the data, there is a lot of obviously public health pressure and political pressure just to make sure it's available as soon as it's deemed safe and effective. So keep your ears out. I know it's a hard wait, especially for us parents of young ones. So
here's a question that just needs some clarification. Could you please remind us what is MIS-C?
Yes, it stands for multi-system inflammatory syndrome in children. And you might see MIS-A, which is just in adults, because it's very rare, but they've seen a few cases in adults. It's a relatively hard concept to explain, except what I can tell you is they think it's an overreaction of your immune system response to the infection itself. They have not seen it with any of the vaccines, so they're not worried about that at this point. But again, we're all monitoring everything. But it is essentially your body becoming very inflamed and reactive. You need a couple systems involved. It can be pretty devastating and life-threatening, because if you think if it's your lung system or your heart system or your kidney system, those are things we need to function. The good news is there is treatment that they've discovered is effective and helpful, but something just it's not subtle. You will know that your child is not feeling well. So not something you have to, you don't have to be worried you're going to miss it. But at the same point, it requires life-saving treatment, and it's pretty devastating to the families that have to go through that.
Okay, here's another one. Are there any contradictions for children receiving childhood routine vaccinations at the same time as COVID-19 vaccination?
Yeah, nope, you can get them all at the same time, which is great. So one-stop shop. So what I do want to say though, is if you hear anyone saying that, because that's specifically the flu, we've heard a lot of people say, I just got my flu shot, so I can't get COVID. That's not true. They're perfectly safe. What we tell parents is, look, since we're asking your body to respond to two, we theoretically think you might have a stronger immune system response, right? So you might be more likely to get chills or a headache than someone who didn't, but we actually don't even have evidence that's the case. So it's just a theoretical risk that we just warn you might be there, but nothing to worry about.
Here's one for kids with special needs. Are there any data points on children with special needs and the vaccine?
There were a few patients who had, special needs is a broad, topic. There were certainly some kids that would qualify for special services or had neuromuscular problems in the initial study. And I can tell you, just knowing who I saw walk through a vaccine clinic a couple of times, we've certainly done it, but they have not taken like a specific cohort and examined it. I can tell you that there's no reason you should think that your child would have a different outcome than someone else scientifically. It doesn't make sense that your child's immune system would respond differently. I think the hardest one is if you have a child who's immunocompromised, because even if we give you the vaccine, which is safe to give you, we just don't know how protected you should feel or how relieved you should feel after you get it. That's the data we're waiting to see.
And here's a concern raised by a parent. She said she would appreciate Children's National being a vocal partner with the mayor to push for advanced planning for the vaccine rollout for the next set of children. She said she was concerned with the rollout of the 5 to 11 and want to make sure that the next set of children have it's easy accessible for school-age children. I think there's a concern with access and equity with large, organized and scheduled appointments for both doses of the vaccine. I think it's more a concern she's raising.
Sure, I can say we work closely with DC Health on this issue, and behind closed doors, equity is a main focus of this, for sure. So I can say at Children's National, since I was part of the team that decided how we were going to roll our vaccines out, we decided that given that even though we knew so many people would want it right away, we wanted to make sure first that we were only making it available first to the patients with medical complexity who are most vulnerable to getting poor outcomes from COVID-19, and those in high-risk neighborhoods who also have vulnerability. What I can tell you is those messages should have gone out to everyone. If you think you qualify and you didn't, we can only reach within our system the people that have touched our hospital, right? We don't have access to everyone's email. But we wanted to make sure that we reached out to them first. And now that we've done 2 rounds of this with the teenagers and the younger kids, I can tell you that we get through that list pretty quickly. So that's why it does feel good now to be open to anyone. So that when anyone, because we know that if we message you on day 1, you might be like, I'm not ready yet, like I might be ready next week. Let me swallow what I just read last night, right? And so we're just trying to balance staying open and accessible to as many people as possible while focusing our attention on the people that are most vulnerable and making sure they have access first. Of course, if you see a partnership that isn't taking place, you can email me, let me know, because that's part of our job, right? Like Julia's on here from Children's as well. We want we want to know where the gaps are so that we can help fill them as best we can. I can tell you for the next group, we are already working on it, and we have for the last couple months. And the reason is pharmacies cannot vaccinate under the age of 3. And so for 6 months to age 2, we know that doctors and nurses need to step up in a big way. We also know that most pediatricians' offices are booked, right? They're taking care of sick kids. They're doing tests to get you back into school. They're now giving vaccines, right? Like, we know that, like, we need to pull resources together. We're working closely with DC Health to try to make that happen. So I hear you loud and clear, and we know we're trying to anticipate everything coming, but we're also really welcome to feedback and opportunity. So let us know.
Will the vaccines at Children's be done inside the hospital or at other locations?
Great question. So we have, if you are not a primary care patient of ours, or you don't come to a certain specialist here at the hospital, then we can offer you an appointment either at the hospital in a COVID vaccine specific clinic, or we have had a couple mass vaccine events. One was at the ARC in Ward 8 last weekend, and the next one is at our Prince George's County location, because Children's does take care of the region, right? So we have to, I know this is a DC focus call, but our region is slightly larger, but we can still invite everyone to each location. So right now, you're right, it is at that main center, but we do have primary care locations offering it and specialty clinics. We have a total of 23 locations offering it. But if you're external to Children's, most of the time, these are the first ones being offered. And if for some reason you can't make it, just let the scheduler know. It usually comes right to my inbox, and we'll do what we can to make it work for you guys.
Dr. Walker Davis, did you want to answer a question? No, you're good. Okay. We have a couple more here. Let's see. There's one. Are there cases of myocarditis for children 5 to 11 after the vaccine?
Great question. So the answer is no. And it's one of the biggest concerns that I know parents have and the FDA itself had. Not necessarily, the FDA didn't necessarily have the fear from a medical standpoint, but they knew that parents had this fear, and they wanted to be able to reassure you that this wasn't going to cause trouble. Myocarditis is the inflammation of the heart muscle. And sometimes you hear it in context with pericarditis, which is the casing around the heart. And anything with itis is inflammation. What we saw was that mostly in the older adolescent boys, usually within a week or 2 after the second dose of the Pfizer vaccine, there was a very small proportion of kids that developed maybe a little chest pain, shortness of breath, what we call palpitations, feels like their heart skips a beat. And they were evaluated and seen to have myocarditis. The good news is very few of them were hospitalized or needed intervention at all, and all of them fully recovered. Our pediatrics article just reported on everything. There are no symptoms that have lasted longer than 28 days is what they looked at. So with that being said, there's a few things to keep in mind. One, it's mild, but we do think it's now associated with the vaccine in the older kids. 2, if you were to get COVID-19 infection itself, your risk, no matter what your age, of getting myocarditis is 10 times higher than if you got it after the vaccine. So something to consider. The other thing is we don't know why, but we know adolescent boys tend to be more prone to getting myocarditis at baseline. So it fits the framework that these were the kids that we saw it in, or the older, the young men is who we saw it in, but we still just don't have a great answer to why. But the good news is it's very transient, it's self-limited, it's very mild when it happens. So, but right now we haven't seen it in the 5 to 11-year-olds, nor do we really expect it, but we are certainly, as doctors, I really want to ensure you guys of this. If I hear someone's knee hurts after I give a vaccine, I have to submit that to the CDC. Like, it is very specific. So this is something we all take seriously. None of us want to be pushing something if this is unsafe. So I personally have reported things like a headache or knee pain. Now, do I think that correlates with the vaccine? No, but I just want you to know we're actively doing this daily in clinic.
Okay, here's another from this person is they're primary care at Children's National, and they have meant for the flu vaccine. Do we need to tell in advance that we want to get the COVID vaccine as well?
This is a slightly specific question. If you want to tell me exactly where you go, if you are at one of the Goldberg centers, so that's the Columbia Heights location, the Shepherd Park location, the main campus location, the ARC or Anacostia, no, you will be asked along with every family member that walks in if you want the COVID vaccine. If you are at one of the Children's National Pediatricians and Associates, most likely you will also get it. I just say that with a caveat that those are those groups, I should say you're still going to get offered it, but those groups are very, they all have little nuances at different places. But for the most part, you should be able to get it and you don't have to give any pre-warning.
Okay. And then the last thing, I think somebody wants to be able to contact you, so we can we drop your contact in chat? Okay.
Yeah, I can put it in there, no problem.
All right. Last chance, any more questions?
Make sure it's spelled right. I do have 2 O's and 2 A's in my name, so.
Okay, wonderful.
Not a typo.
Yay. This was really wonderful. We really appreciate you taking the time, and let me make sure one last chance. I don't see any more questions in the Q&A or in the chat. Awesome.
I think you guys hit on most of the common questions we get for sure. And I hope for those parents out there who maybe weren't ready to make the decision day one, which I'm guessing are the parents that are joining this, that if you now hear that millions of kids have gotten it, and remember, this is just a smaller dose of the one that's been given hundreds of millions of times by now to the older population. And that's something as a parent myself, I just felt better about. I was like, you're right, this is the same one that we've done. It's just a smaller dose. And it comes with a lot of benefits. And it certainly not only takes care of your baby, but it takes care of the community around us, because this is just going to continue until we can really prevent the spread, which if we can't separate ourselves, we can't wear masks. I mean, the only other option is vaccine or get sick. And the benefits are far better getting the vaccine than getting sick.
Okay. All right. This was great. I don't see any questions in the chat. Michelle, you want to say any final?
Just a huge thank you to Dr. Boogaard and also Children's National. I have heard similar presentations before. I've heard the data before, and it's always comforting to hear it again, to be reassured, specifically related to children. I have my own little ones, and you just did a wonderful job of making it simple and understandable, and I really appreciate it. So thank you for your time.
Thank you. It's an honor to be here. And again, you have my information if I can be helpful.
Okay. Thank you, Dr. Boogaard. Thank you.
Okay.
Great weekend, everyone. Bye.